Hello and welcome to this video about constipation. Constipation is a common digestive disorder that causes bowel movements to happen less often or to be hard to pass. The discomfort or pain it causes can have a serious effect on a person's standard of living. This video will go over what causes constipation, how to recognize it, and what you can do about it. So, before we get started, don't forget to like, comment, share, and subscribe to our channel. Let's begin with a discussion of what can cause constipation. Numerous factors, including a person's diet, lifestyle, or even a medical condition, can contribute to constipation. Constipation can be caused by a lack of fiber and fluids in the diet, as well as by inactivity. Constipation can be brought on by a variety of medical issues, including pregnancy, IBS, and the use of particular medications. We will now move on to a discussion of the signs and symptoms of constipation. Most people with constipation experience a decrease in bowel activity, but other symptoms can include pain, bloating, and difficulty passing stools. Constipation is a condition in which a person experiences hard, dry stools and the sensation that they must exert extra effort in order to defecate. An enema or colonoscopy may be necessary for severe cases of constipation. If you have chronic constipation and have tried lifestyle changes and over-the-counter medications without success, you should talk to your doctor. Constipation can have a wide range of potential causes, and the underlying cause may vary from person to person. Instances of this are common. Constipation can be caused by not getting enough fluids and fiber in your diet. Fiber adds bulk to feces, making them easier to pass, and liquids keep them soft and moist. The inability to move around enough or resist the urge to defecate are two of the main causes of constipation, along with a lack of fiber in the diet and a lack of fiber-rich fruits and vegetables. Disabilities and diseases in the medical field. Constipation can be caused by a number of health problems, such as pregnancy, irritable bowel syndrome, IBS, and some neurological disorders. Some medications, including antidepressants and pain relievers, can cause constipation as a side effect. Fractures in the anus. Fistulae in the skin around the anus, known medically as anal fissures, can be extremely painful and uncomfortable when bowel movements are involved. Constipation can result from these conditions as well, because people often try to avoid the discomfort of a bowel movement by going for longer periods of time between bowel movements. Alterations in hormone levels. Changes in hormone levels, such as those experienced during menopause or pregnancy, have been linked to constipation. Stools that have become dry and hard from dehydration can be a nuisance to pass. Constipation is a common problem, but it can also indicate a more serious health issue, like colon cancer or a blockage in the intestines. If you have persistent constipation or any other concerning symptoms, you should consult a doctor. Cough and cold remedies. Fiber and water intake should be boosted. Eating more fiber-rich foods like fruits, vegetables, and whole grains can help you have more manageable bowel movements. Be sure to drink plenty of water and other fluids to keep yourself well hydrated. Consistent physical activity is highly recommended. Constipation can be avoided, and regular exercise can help stimulate bowel movements. Non-prescription drugs. Constipation can be alleviated with the help of fiber supplements like psyllium or methylcellulose, as well as laxatives like bulk-forming agents or stimulant laxatives. If you're taking any kind of medication, read the label carefully and consult your doctor if you have any questions. Beneficial bacteria found in probiotic supplements may aid in digestion and flora balance, thereby reducing the risk of gastrointestinal issues like bloating and constipation. Supplements and fermented foods like yogurt and sauerkraut are good sources. The use of a stool softener, like docusate, can make bowel movements more manageable. An enema is a technique used to encourage bowel movements by introducing liquid into the rectum via the anus. Extreme cases of constipation may benefit from enemas. Rub the belly. The practice of clockwise abdominal massage has been shown to promote regular bowel movements. The practice of biofeedback sensors in biofeedback therapy are used to keep tabs on a patient and help them learn to regulate bodily functions like urination and defecation. In some cases, it can help relieve constipation. In acupuncture, a form of traditional Chinese medicine, thin needles are put into certain points on the body. Constipation relief studies have shown positive results with this method. Drugs that require a doctor's prescription medication to treat constipation may be prescribed by a doctor in severe cases. Medication to stimulate intestinal muscle contractions or laxatives can fall into this category. If lifestyle changes and over-the-counter medications haven't helped with your constipation, it's time to see a doctor. They will be able to aid in the diagnosis of your constipation's root cause and in the selection of the best treatment for you. Constipation, in a nutshell, is a common digestive disorder that can be uncomfortable and even painful. Constipation can be avoided with measures like a healthy diet, regular exercise, and plenty of water. Those who continue to struggle with constipation despite these measures should consult a doctor. A big thank you to anyone who stuck around to see the end.